40% of people over 70 have levels of one specific vitamin so low that their legs are losing blood flow right now without them knowing it. A clinical study with over 1,000 older adults showed that correcting this deficiency increased leg circulation by up to 400% in just 12 weeks. Today, you will learn about the 6 vitamins that restore circulation in your legs, ranked from general support all the way up to the one that completely transformed the mobility of thousands of people over 70. And number 1 will surprise you. Leg circulation does not deteriorate simply because we age. What actually happens is that the inner lining of your blood vessels, called the endothelium, starts breaking down when certain vitamins fall below critical levels. Researchers at Johns Hopkins followed more than 2,000 older adults for 8 years and discovered that those who maintained strong leg circulation into their 80s did not share exceptional genetics or extraordinary exercise routines. What they shared was a specific nutrient density, 6 vitamins that work together to keep blood vessels flexible, responsive, and fully functional. The science behind this is clear, and the results are measurable. Stay until the end, because the number 1 vitamin on this list produced results that surprised even the researchers themselves. And there's an absorption protocol that multiplies its effectiveness tenfold, a detail most doctors never mention. Vitamin 6. Vitamin K2. Most people confuse vitamin K1 with K2, but they serve completely different functions inside your body. While K1 is related to blood clotting, K2 has a silent and critical mission for your legs, preventing calcium from depositing inside the walls of your arteries. When calcium accumulates where it should not be, your vessels harden, narrow, and lose the ability to expand and contract to push blood from your feet back up to your heart. This is not theory. The Rotterdam study, which followed 4,800 people over an entire decade, found that those with the highest K2 intake had 52% less arterial calcification in leg vessels compared to those with the lowest intake. That difference is not marginal. It is the difference between walking normally and struggling to climb a single flight of stairs. The real problem with K2 is that it has virtually disappeared from the modern diet. Our grandparents obtained it naturally from butter, eggs, and organ meats from grass-fed animals. Today, unless you consume fermented foods like Japanese natto, you're probably not getting any significant amount. And after 70, the situation worsens because the gut bacteria that help convert K1 into K2 begin to decline. If you decide to supplement, look for the -7 Malawian Quatches form, which stays active in your bloodstream for 72 hours, unlike -4 Malawian Quatches, which disappears in just 8. The dosage that showed reversal of arterial calcification in clinical studies is 180 micrograms daily, always taken with a meal containing fat, because K2 is fat-soluble and your body simply cannot absorb it without dietary fat present. Breakfast with eggs and avocado is the ideal time to take it. Vitamin 5. Vitamin E. Vitamin E is usually associated with skin health, but what it actually does inside your leg vessels is something far more significant. Your blood vessels are under constant attack from free radicals, unstable molecules produced as part of normal metabolism that create oxidative damage to vessel walls, making them stiff and narrow over time. Vitamin E acts as a protective shield for that endothelial lining, neutralizing free radicals before they can cause permanent damage. A Mayo Clinic study of 3,000 older adults used thermal imaging to measure circulation in the lower extremities and found that those with optimal vitamin E levels had 65% better blood flow compared to deficient individuals. On the thermal scans, the difference was visible to the naked eye. Healthy circulation showed up as bright red, while poor circulation appeared as dark blue, almost black in some cases. This is where most people make a serious mistake. They buy synthetic vitamin E versions at the pharmacy, and their bodies can barely use them. Natural vitamin E from food sources is 8 times more bioavailable than synthetic. That means if you're taking synthetic vitamin E, your body is wasting 87% of what you swallow. The best food sources are raw almonds, sunflower seeds, and wheat germ oil, but they must always be consumed alongside healthy fats like olive oil, avocado, or coconut oil because vitamin E needs fat molecules to cross the intestinal lining and reach your bloodstream. If you supplement, look for mixed tocopherols on the label because your blood vessels need all 8 forms of vitamin E working together. The effective dosage in clinical trials was 400 international units daily, but split into 2 doses of 200 with meals to optimize absorption. A German study showed that older adults who took vitamin E with their largest meal absorbed 73% more than those who took it on an empty stomach. Vitamin 4. Vitamin C. Vitamin C seems basic. It is probably the first vitamin we all learn about as children. But what very few people know is what happens inside leg vessels when there is a chronic deficiency, and after 70, most people find themselves in exactly that situation without realizing it. Your blood vessels are held together by collagen, the same protein that keeps skin firm, and your body is biochemically incapable of producing collagen without vitamin C. Without it, vessels lose structure, weaken, and can no longer flex properly. Researchers at Stanford published findings showing that older adults with optimal vitamin C levels had blood vessels that were 40% more elastic than those who were deficient, 40% more capable of expanding and contracting, which is absolutely critical because your leg vessels need to flex thousands of times every day to push blood back to the heart against gravity. The problem with vitamin C is that it is water-soluble, meaning your body cannot store it. Most people take one large dose in the morning, but their kidneys filter it out within hours, leaving them deficient for the rest of the day. The split-dose protocol works far better. Instead of 500 milligrams once a day, taking 200 milligrams 3 times daily with meals maintains stable blood levels and gives your vessels constant access to the nutrient they need for repair. A little-known fact, kiwi fruit contains 3 times more vitamin C than oranges, and it is bound to fiber that creates a sustained release effect in the intestines. If you supplement, avoid standard ascorbic acid tablets because they are harsh on the stomach and poorly absorbed. Look for buffered vitamin C or sodium ascorbate, and always take it with bioflavonoids like quercetin or rutin, compounds that protect vitamin C from oxidation and drastically increase its effectiveness. Red bell peppers are an extraordinary source because they contain both the vitamin and capsaicin, which dilates blood vessels immediately. Vitamin 3. Vitamin B3, niacin. Niacin has an ability that no other vitamin possesses. It forces your blood vessels to expand within minutes of taking it, creating what doctors call a flush. The skin reddens, feels warm, and that warmth is millions of tiny blood vessels opening simultaneously, allowing oxygen-rich blood to rush through capillaries that have not received adequate flow in years. The Cleveland Clinic gave a group of older adults with poor leg circulation 500 milligrams of niacin daily and measured results with ultrasound technology. What they found was extraordinary, a 180% increase in leg circulation within just 6 weeks. Many participants reported that chronic nighttime leg cramps, the kind that jolt you awake at 3 in the morning, disappeared completely during the same study period. Niacin works through multiple mechanisms simultaneously. It reduces the sticky LDL cholesterol that clogs arteries, raises the protective HDL cholesterol that cleans vessels, and triggers the release of prostaglandins, compounds that dilate blood vessels like widening a highway from 2 lanes to 6. The flush that many people experience, which can be uncomfortable at first, is actually a sign that the vitamin is working exactly as it should. To minimize discomfort, there is a gradual introduction protocol. Start with just 50 milligrams after dinner for 1 week, then increase to 100 and work your way up to 500 milligrams over the course of a month. The immediate release form is actually better for circulation than extended release versions, precisely because it creates that beneficial flush. Food sources include turkey, chicken breast, and peanuts, but if you take acid-blocking medications for heartburn or reflux, you're likely not absorbing much niacin from food at all, because dietary niacin is bound to proteins that require stomach acid to break down. The most effective protocol, according to evidence, is 250 milligrams of immediate-release niacin twice daily with meals. Vitamin 2. Vitamin D3. Vitamin D3 is technically a hormone, not a vitamin. It controls more than 1,000 genes in your body, including those that determine how well your blood vessels function. The famous Framingham Heart Study revealed data that should concern anyone over 70. People over 75 with vitamin D levels below 30 nanograms per milliliter had 80% greater arterial stiffness and 62% worse blood flow to the extremities compared to those with levels above 50. That difference translated directly into walking ability. Those with optimal levels could walk miles without issue, while the deficient ones struggled to make it around the block. Your blood vessels have vitamin D receptors along all their walls, and when D3 activates them, they trigger the production of nitric oxide, the master molecule that relaxes and dilates your vessels, allowing blood to flow freely even through the tiniest capillaries in your toes. There is a crucial detail about D3 supplementation that almost nobody mentions. After 75, your skin produces 75% less vitamin D from sun exposure compared to when you were young. Even if you spend time outdoors, your body simply cannot produce enough anymore. Supplementation becomes virtually mandatory. But taking it alone without vitamin K2 can be counterproductive because D3 increases calcium absorption, while K2 is responsible for directing that calcium away from arteries. Taking D3 without K2 can, paradoxically, worsen arterial calcification. The optimal protocol, according to evidence, is 5,000 international units of D3 taken with breakfast, along with 180 micrograms of K2 in negative 7 Malawin-Quatches form, and always accompanied by at least 15 grams of fat, because D3 absorption increases by 50% when taken with a fatty meal. Wild salmon, sardines, and mackerel are the best food sources because they contain both D3 and omega-3 fatty acids that enhance the circulatory benefits. But you would need to eat fish practically every day to maintain optimal levels, which is why supplementation is almost always necessary for older adults. Vitamin 1. Vitamin B12. Here we arrive at the vitamin that transforms everything. And I need you to pay very close attention because this is the one most doctors overlook entirely and the one that produced the most impressive results in clinical trials. A Japanese study of 1,000 older adults found that proper B12 supplementation increased leg blood flow by an astonishing 400% in 12 weeks. Some participants went from barely being able to walk to their mailbox to completing 5-kilometer walks. The reason B12 is so extraordinarily powerful for circulation is that it controls 3 critical functions simultaneously. First, it is essential for producing the red blood cells that carry oxygen to your legs. Second, it maintains the myelin sheath that protects the nerves responsible for controlling your blood vessels. Third, it reduces homocysteine, an amino acid that damages vessel walls and creates chronic inflammation that progressively blocks blood flow. The most alarming part is this. After 60, your stomach produces less acid and less intrinsic factor, the two substances absolutely necessary for absorbing B12 from food. By 75, up to 40% of people have levels so low they're experiencing neurological damage without even suspecting it. You could be eating generous amounts of meat every week and still be severely deficient. The symptoms of this deficiency perfectly mimic what most people assume is normal aging in their legs. Numbness, tingling, weakness, poor balance, that burning sensation that disrupts sleep. But these symptoms are not normal. They are signals that your nerves and blood vessels are literally starving for B12. The standard blood test for B12 is practically useless because it measures both active and inactive forms. You need to request a methylmalonic acid test to know your true status. And here is the game-changing detail. Sublingual B12 supplements, the ones that dissolve under the tongue, bypass the digestive system entirely and pass directly into the bloodstream through the rich network of vessels beneath the tongue. This provides absorption up to 10 times greater than conventional pills. The form you need is methylcobalamin, not cyanocobalamin. The effective dosage is 1,000 micrograms of sublingual methylcobalamin every morning, letting it dissolve completely without swallowing. Within the first 2 weeks, most people notice warmer, more responsive legs. Within a month, numbness begins to recede. Within 3 months, many are walking distances they had not managed in years. Now that you know all 6 vitamins individually, it is essential that you understand something most health channels never explain. These vitamins do not work in isolation. They function as an interconnected system where each one amplifies the effects of the others. Vitamin K2 directs calcium out of arteries, but it needs D3 to ensure sufficient calcium is being absorbed and routed toward bones where it actually belongs. D3 activates vascular receptors that produce nitric oxide, but that nitric oxide degrades rapidly if vitamin C is not present to stabilize it and regenerate the collagen lining of the vessels. Vitamin E protects that lining from constant oxidative damage, but its antioxidant capacity multiplies when vitamin C recycles it after it has neutralized a free radical, meaning C and E work as a chain protection team. Niacin dilates vessels acutely, but that dilation is only beneficial long-term if the vessels have the structural flexibility provided by C, E, and D3. And B12, the most powerful of all for circulation, needs blood vessels that are not calcified in order to deliver the oxygen-loaded red blood cells it helps produce. Without K2 clearing the calcification and without D3 keeping vessels responsive, even perfect B12 levels encounter a vascular system too rigid to respond adequately. This synergy explains why so many people take individual vitamins without seeing significant results. They're feeding one piece of the system while the others continue deteriorating. A study published in the European Journal of Clinical Nutrition followed 1,200 older adults over 5 years and discovered that those who maintained optimal levels of at least 4 of these 6 vitamins simultaneously had 70% lower risk of developing peripheral arterial disease compared to those who optimized only 1 or 2. The combination matters more than any individual vitamin. That said, do not make the mistake of trying to incorporate all 6 at once. That is a sure path to confusion, abandonment, and probably a drawer full of forgotten supplement bottles. The approach the evidence recommends is staggered. Start with sublingual B12 in the first week, because its effects are the fastest and most noticeable, and that early sense of improvement will motivate you to continue. In the second week, add D3 together with K2 at breakfast, since these two should always be taken together, and it is easy to turn them into a single morning habit with eggs or avocado. In the third week, incorporate vitamin C in 3 doses distributed across each main meal. In the fourth week, add vitamin E with your largest meal of the day. And if after a month you feel ready, introduce niacin starting at the lowest dose following the gradual protocol. Each step builds on the previous one. By the 5th or 6th week, your body will already be responding. Warmer legs, less heaviness, greater ease walking distances that used to challenge you. But there is something equally as important as the vitamins that many people overlook: movement. You do not need intense exercise, but walking 15 minutes twice a day activates the calf muscle pumps that help push blood back to the heart. That simple action, combined with all 6 vitamins at adequate levels, can transform your leg circulation within weeks. The science leaves no room for doubt, and the protocols are straightforward. The only thing missing is the decision to begin. You do not need to start all 6 vitamins tomorrow. Choose one, just one, and commit to it for 30 days. If you can, get a blood test before you start so you know your baseline. Pay attention to what changes in your legs over that month: the temperature, the sensation, the ability to walk. Consistency makes the difference. Your legs have carried you through decades of experiences, through moments that matter. They deserve better than being dismissed as just part of getting older. These 6 vitamins, especially number 1, give them exactly what they need to keep carrying you forward. Do not wait until walking becomes a struggle. Start today. If you want to keep learning how to maintain strength, circulation, and mobility after 70, you will find more evidence-based content right here. Next week, we will cover the 3 foods that are silently damaging leg circulation in thousands of people over 70, and I guarantee at least one of them is in your kitchen right now.